Are you suffering with a thyroid condition? Are you experiencing debilitating thyroid symptoms, even though you are taking medication or your lab tests are normal? Hi, I'm Dr. Jeff Forsley with Lamont Natural Healthcare. I've been in practice since 1984, and as a holistic and chiropractic physician, I believe in treating the whole body. I love what I do, and I am passionate about my profession. I have been helping people for 28 years. I have taken thousands of hours of postgraduate education to keep up on cutting-edge technology and procedures to help my patients get better. Over the years, I have studied advanced neurometabolic therapies with renowned physicians such as Dr. Datiz Karazian, Dr. Ari Vojdani, Dr. Brandon Brock, Dr. Shane Stedman, Dr. Steve Noseworthy, Dr. Michael Pierce, Dr. Thomas Culleton, Dr. Andy Barlow, and Dr. Michael Johnson. As a holistic physician, I believe in evaluating the whole body as well as using cutting-edge protocols for thyroid conditions. A holistic therapy program is based on the evaluation of the whole body using natural protocols and dietary-based recommendations that safely work with your body. If you are suffering with a thyroid condition and want to get your life back, you need to invest the next 15 minutes watching this video. Why spend the next 15 minutes watching this presentation? We're going to answer some questions you may have regarding your unresolved thyroid condition. We're going to explain my unique, comprehensive, holistic approach to managing your unresolved thyroid condition. And we're going to change your life. At Lamont Natural Healthcare, we offer advanced treatment protocols for thyroid conditions. The thyroid hormone is the master metabolism hormone. When it is low, body functions slow. When it is high, the body functions will speed up. There are 3 different types of thyroid conditions. Number 1, hypothyroid. This is low thyroid hormone levels. Symptoms of hypothyroid include fatigue, weight gain, poor memory and brain fog, poor sleep, difficulty getting out of bed in the morning, the need for more sleep to function, depression, constipation, sensitivity to cold weather, poor circulation, digestive problems, dry skin, thinning hair, and a poor immune system. Number 2, hyperthyroid. These are high thyroid hormone levels. Symptoms of hyperthyroid include heart palpitations, rapid heart rate, insomnia, night sweats, excessively nervous and emotional, difficulty gaining weight, and exophthalmia or protruding eyes. Number 3, Hashimoto's thyroid. This is a combination of hypothyroid and hyperthyroid, so you would have periods of low thyroid symptoms alternating with periods of high thyroid symptoms. Every cell in your body has thyroid receptors, so if your thyroid is not functioning properly, your whole body is off balance. Many chronic health conditions have some common threads. Some of these conditions, including the thyroid, include peripheral neuropathy, diabetes, fibromyalgia, rheumatoid arthritis, irritable bowel syndrome, and many others. The metabolic imbalances include anemia, chronic inflammation, unstable blood sugar, adrenal gland dysfunction, hormone imbalances, autoimmune attacks, chronic infections, food sensitivities and allergies, medication side effects, hypoxia or low oxygen, and nutritional deficiencies. Neurologic imbalances include any abnormal nerve signals from the brain to any part of your body. All patients with these conditions are managed metabolically and neurologically in our clinic. Metabolically, this involves balancing the hormones, the digestive system, and the immune system. Neurologically, it means balancing the brain and the nervous system. Your brain controls 100% of your body's functions, and this includes the thyroid. Your hypothalamus, which is part of the brain, controls your pituitary gland, which is located inside the cranium. Your pituitary gland controls all other hormone glands. This includes the thyroid for general body metabolism, your parathyroids for calcium metabolism, your pancreas for insulin and digestive enzyme production, your adrenal glands, which produce stress hormones, and your ovaries and testes, which produce estrogen and testosterone. The thyroid gland produces two forms of thyroid hormone, T3, or the active form, and T4, the inactive form. The majority of the thyroid hormone produced from the thyroid is T4, the inactive form. TBG, or thyroid binding globulin, is a protein that transports thyroid hormones throughout the bloodstream. T4 must be converted to T3, the active form, for thyroid hormone use in the body. 80% of this conversion takes place in the liver and the digestive system. Thus, digestive and liver problems will prevent this conversion. Finally, the active thyroid hormone has to be transported to your cells and be absorbed for use. There are 8 major thyroid patterns. Primary hypothyroidism, which means your thyroid is just not producing enough thyroid hormone. Hyperthyroidism. The thyroid gland is producing too much thyroid hormone. Secondary hypothyroidism to primary pituitary hypofunction. This just means your pituitary gland is the actual problem and it is not sending the proper signals to your thyroid. Thyroid underconversion of T4 to T3, thyroid overconversion of T4 to T3, thyroid binding globulin elevations, thyroid resistance, and autoimmune thyroid. Diagnosing which pattern or patterns apply to you is the first step in diagnosing and managing your thyroid condition. In order to diagnose you properly, we order up to 11 thyroid tests, not just TSH. Do you suffer with thyroid symptoms but were told all of your lab tests are normal? We use functional lab test ranges that are more specific. This is how we properly diagnose people who are misdiagnosed or undiagnosed. Most thyroid conditions are not primary thyroid problems. They are autoimmune system conditions. Your immune system is mistakenly attacking your thyroid. If this is not diagnosed and managed, you will never get better. Your immune system is designed to protect you, so why would it attack your own body tissue? The answer is dysregulation and active antigens. Dysregulation involves chronic or severe stress, inflammation, blood sugar imbalances, neurologic imbalances, and poor digestion. Antigens include chronic infections, viral, bacterial, parasites or yeast, food allergies, gluten sensitivity, and environmental toxins. These are the underlying causes of your immune imbalance. If these factors are not addressed, you will not get better at the highest possible level. Taking steroid medication can decrease your symptoms, but does not address the underlying cause. We will. If you are autoimmune against one tissue, your immune system will proceed to attack more tissues over time. If you are not properly diagnosed and managed, you have a high chance of developing multiple autoimmune conditions. Autoimmune conditions include rheumatoid arthritis, lupus, Crohn's disease, celiac disease, MS, ALS, scleroderma, ankylosing spondylitis, type 1 diabetes, Raynaud's, ulcerative colitis, Sjogren's, Guillain-Barré, eczema, psoriasis, and sarcoidosis, just to name a few. Traditional treatment for autoimmune conditions include steroid medication, Enbrel, and Remicade medications. These drugs shut down your immune system and can give symptom relief. However, without an immune system, you are prone to infections and cancer. Once you are diagnosed with an autoimmune condition, you can't be cured. However, we can manage your condition to slow current tissue destruction and prevent future secondary conditions. So let's talk about the digestive system. Leaky gut syndrome is a degeneration of the lining of the digestive system. This allows toxins to leak into the bloodstream, which leads to an autoimmune reaction. Leaky gut syndrome is commonly a prerequisite to autoimmune conditions. 70 to 80% of your immune system is in your digestive system. Immune system triggers such as infections, parasites, food allergies, and gluten sensitivity all lead to oxidative or cellular stress. This leads to glutathione depletion. Glutathione is the most powerful antioxidant in the body. When glutathione is depleted, it activates INOS or nitric oxide synthase. Once this occurs, you now have an autoimmune reaction and tissue destruction. Eliminating triggers, proper dietary changes, balancing glutathione and nitric oxide synthase is critical to the management of autoimmune conditions. Gut inflammation leads to the production of inflammatory cytokines, which circulate in the bloodstream and cross the blood-brain barrier and react with the brain's immune cells, thus causing brain inflammation. So when you have gut inflammation, you will eventually have brain inflammation. The brain controls 100% of your body. It is affected by thyroid imbalances and inflammatory cytokines, as well as anemia and blood sugar imbalances. Our unique approach to managing thyroid conditions involves metabolic and neurologic balancing. Metabolically, we balance your hormones, the digestive system, and the immune system. And neurologically, we balance the brain and the signals from the brain to the body. So when we started the presentation, we were just thinking about the thyroid. Then we added the effects of the nervous system, the digestive system, and the immune system on your thyroid condition. Hopefully you now understand the other factors involved that must be addressed if you want to improve. In summary, there are 8 patterns of thyroid imbalance. We must determine which pattern or patterns are out of balance with you. We must do comprehensive testing. We have to diagnose and manage your autoimmune condition. We must address the underlying cause, which is usually an autoimmune imbalance. Leaky gut syndrome diagnosis and management. Metabolic and neurologic management. You are obviously watching this because you or someone you know has a persistent thyroid condition that is not responding to conventional treatment. I believe I can help you. Now let's ask some questions. How has your thyroid condition affected your life? How effective is your current treatment? What things do you love to do that your thyroid condition is preventing you from doing? Where do you picture yourself in the future if your thyroid condition does not improve? Einstein once said the definition of insanity is doing the same thing over and over, but expecting a different outcome. It's time to do something different and change your life. If you would like to hear more about my thyroid recovery program, I'm going to make it as easy as possible. For a limited time, I am offering you a free consultation to explain my thyroid recovery program in detail and determine if it is right for you. So why would you accept my offer for a free consultation? Because I'm going to explain my thyroid recovery program to you in detail. We will determine if my program is right for you. We will allow you to ask specific questions you may have that haven't been answered, and to get your life back. Call us at 630-257-0550. I look forward to seeing you.